Hi, everybody. I'm Chris Preimesberger, editor of eWEEK. Thank you very much for joining us today for this latest eWEEK eSpeaks segment. eSpeaks is a series of conversations with IT thought leaders from every corner of the IT business. Today, we're going to talk about healthcare IT, which is especially important in this day and age of COVID-19. Our guest is Aditya Bansod. Aditya is the co-founder and CTO of Luma Health, and that's Luma Health, based in San Francisco. Aditya, welcome.
Thanks, Chris. I'm excited to speak to you this morning.
Yeah, gosh, talk about timeliness. This is really important. What Luma does is basically help people get better and to avoid the COVID. Can you give me could you answer a couple questions? Tell us a little bit about your background, if you could, and
Sure.
then a little bit about how Luma got started and what it was doing before the COVID.
Yeah, so kind of pleasure to, like I said, pleasure to meet you, Aditya, one of the co-founders and CTO here. And kind of my story is pretty much a vanilla, if you will, a vanilla Silicon Valley technology person. So I spent the first half of my career at Adobe and Microsoft, those are my training wheels, and before moving to venture-backed startups. And kind of as a product manager, product marketing, technologist, engineer, those sort of roles. And me and my co-founders, we founded Luma in February 2015. And really the goal of the company was to make it easier for patients to get access to healthcare. That gap between patients and their providers is really challenging. And our mission, even before COVID, was reduce those barriers of entry and that friction between patients and providers. And kind of early, February, March last year, when the pandemic started to go from just like a small drum to a timpani to a huge drum beat to a cacophony, we really had an opportunity to take what we've been working on in the past, scheduling, patient communication, outreach, population health management, and really use that as an opportunity to help patients get access to, telehealth or notified when there was COVID outbreaks in their area. So, like Chris, you're saying, it's very timely right now because with the vaccine starting in December, we started working with a lot of our health system partners to help them schedule, communicate with, follow up with their essential providers, their essential workers, and now they're over 65s. They're seniors in the various communities. So it's an exciting time. I think it's like, we were founded on this vision that like help the patient get access to healthcare. Just, that's a big challenge. And this opportunity has been wonderful for us to kind of be able to help get America vaccinated.
Very good. Tell me how the process works. So you're out there. How do you get connected with a particular healthcare system? Do they call you and hire you? Do you reach out to them? How's that work? Or is it a little bit of both?
Yeah, it's kind of a little bit of dealer's choice. It's a little bit of both. I think one of the things that really stands out when we're thinking about doing, especially kind of in the context of COVID vaccinations, thinking about doing these when we reach out or people come out to us, is how can we kind of fit into their existing healthcare infrastructure? Health IT is a very complex beast, right? With a lot of technology that's been around since the 70s. That is kind of like the backbone of how health IT works. And especially for kind of the other technologists and technology enthusiasts who might be watching, being able to plug into that and fit into those existing workflows is really part of that conversation that we have around how do we stand up what we call vaccine operations inside your existing healthcare infrastructure to really scale up for high velocity care, like when you've got to move 7, 8, 9, 10,000 patients through a system a day, which is a scale that not a lot of people have run through before. And it's incredibly challenging to stand up software systems to do that.
The medical world is notorious for moving slowly when it comes to technology, isn't it? I mean, you mentioned that you're still using tech from the 70s, and well, there's one thing about it: if it works, it works. But eventually, it's not gonna work anymore.
Right.
And so, have you found the reception to Luma and what it does pretty welcoming from healthcare providers, or are they hesitant to move to something new?
No, and I think, there was a lot of when we started the company in 2015, 2016, where we were changing a lot of hearts and minds, really talking to health providers about like, hey, you have to modernize, how the patient experiences. You have to really think about patient relationship management as opposed to, transactional, like a patient shows up and you charge the insurance company. How do you think about them as patients, as real relationships you nurture long-term? And come to 2020 pandemic, I think kind of the whole industry turned on a dime, and it's like, we're losing lots of money because, elective procedures are down. We've got to figure out how to stand up telehealth, which was always around, but it was never really a thing. And then now, how do we actually move patients through, 2 vaccines with complicated delivery processes, all that sort of stuff. And I think healthcare systems and healthcare providers, they want to meet the challenge. But I think the kind of the last year's worth of dialogue in health IT is, how does the kind of the Voltron, if you will, the transformers of legacy health systems and modern technology solutions really transformer together to make a 1 + 1 = 3 solution.
Yeah. Telehealth, we've been talking about for a while as being really one of the future tenants or future ways for people to get their health care, with a doctor that can look at an x-ray where he or she is and then prescribe something, via Zoom conference or whatever. And what you guys do is bring a completely different dot to connect. What are some of the dots? How would you describe the IT dots that you connect to get the job done? Because I think a lot of people don't understand it's not just telehealth.
Yeah, that's right. I mean, when we talk about like our product and our vision, we talk about the patient's journey. So like, say you, Chris, you're like, I know I need to get access to care. Your first question is like probably Dr. Google, like that's where the conversation starts for you. And then, that's just the beginning. So needing care, getting access to care, being ready for care, receiving care, and then following up from care, right? And it's that journey that patients go on. And connecting all the dots on that require what we call like a digital transformation for a lot of health systems, where you start with, hey, can I even let my patient schedule online? How does that work? What if, Chris has not been to, or Aditya has not been to my local health system before, but their doctor that I want to see or the service that I want to get is available there at a time I want to get? How do I even register that patient? Make sure they've got insurance eligibility. And there's an entire set of health IT questions to answer about like, how do I even register this patient? Make sure that Chris is not Christopher, is Aditya is not Ad, or like whatever it might be, right? Like identity. And then there's all the piece around scheduling, which, scheduling is, I live my life in Google Calendar. We live our lives in Outlook calendars. But when it comes to healthcare, it's incredibly complicated. Are you allowed to see that same physician within a year because of the insurance? Mm-hmm. Actually, COVID's a really good example. We work with some really large health systems who have had to work with us on this, which is some patients, they may actually try to game the system and try to book 3 COVID vaccine appointments, not knowing that, when the supply will happen. But that takes away from other patients' opportunities. So actually setting up specific rules so that patients are only able to book certain types of appointments at certain times. And so there's all sorts of like, scheduling components that are very, very complicated that tie down into the underlying what's called practice management system. And then there's actual care itself, like the record of Aditya received the vaccine. I had the x-ray. My x-ray happened with this specific machine under this specific radiation settings. And actually the medical record and the electronic medical record. And tying all those pieces together, I think requires a digital transformation along that journey. That's the part that kind of ties it together, articulating that vision of how do I want my patients to get access to care? And then tying those various IT components underneath it is an incredibly large integration job underneath that.
Yeah, I know. Most people do not understand under the hood what goes on with companies like yours. And it can be very, very complicated. And, we're talking about people's health here. We're talking about very important topics and data. In fact, I was going to bring up the idea that today is actually Data Privacy Day all around the world, January 28th. And so that connects with healthcare records. Does Luma have access to healthcare records of customers? Or are you just the conveyor of data from one place to another? What does that work?
Even like, so the United States, there's one critical law, 2 really critical, but one that we hear a lot about, which is called HIPAA. Yeah. HIPAA is the overarching law. And in the United States, where we may be kind of, behind maybe Europe in terms of like general data privacy with GDPR and that sort of stuff, where we really set a high bar is on patient health data. And the United States was an early mover with that, and also with some other kind of really interesting elements around your right to your own data. So like, in the past, getting a copy of your chart was incredibly difficult, right? With authorization, the physician would maybe only share with the other physician. there's a lot of legislative and administrative changes that are happening, say like, hey, I, Aditya, as a patient, have the right to my own data, which is actually pretty forward looking, right? The tides are shifting because there's the part that you want to unlock underneath that saying, hey, I want to actually take this information and do something valuable with it. And so HIPAA, my right to my information, it's called the information blocking rules. Vendors like Luma Health, we have to operate within those frameworks, right? We have very, very strict guidelines on top of how that concern how we, encrypt your data, how we provide audit logs for your data, how we have to respond to discovery by legal discovery procedures for your information. And so this is part of it. Like if you're a founder and you're looking to stand up a health IT company, like that's the first conversation you have, right? Is like, how do I deal with audit, compliance, security, regulation, all that sort of stuff. And then you talk about the product. Right? Because without those, you don't have a health company. And HIPAA is so, it's very programmatic in some ways, which is even if we were just a conduit, right? We still have all the same rules that like a, Harvard Health, Banner Health, Mount Montefiore Health, like all these big health systems might otherwise have. So we don't get to play fast and loose with it, and no healthcare vendor does. If it smells like PHI, if it looks like PHI, it's definitely quacks like a duck, it is PHI, and you have to follow all the rules.
Yeah, absolutely. Okay, we got about a minute or so left, Aditya, and I guess my final question to you here would be, because of COVID, obviously, our lives have changed in many ways, many ways. We're not traveling as much. We're using remote applications like Zoom and others, WebEx, to talk to each other and do business. We're not leaving our homes as much. And then we've got companies like yours that are coming to the rescue on helping us get medicine. How do you think that this last year has impacted your company for the future? Are these duties or are these actions that we're going to be continuing to do further on after COVID is come and gone because of the ability that you brought to the IT world?
So first of all, Chris, I think it's very flattering. Thank you for saying that we're helping. But there's an entire community of health IT professionals who I think are all trying to make the state of the art and kind of eliminate the pandemic from the general consciousness. And it takes a village. It really will take a village of vendors, health systems, medical professionals, health IT professionals, nurses, doctors, everyone to kind of scientists to really kind of put the squeeze on what's going on.
Sure.
But I think there's a lot of changes that have happened to our company that are for the positive in some ways. Like I was saying earlier, we've really had the opportunity to make telehealth like a big part of the healthcare conversation. Our own company, we're now hiring people outside the Bay Area, getting access to talent pools elsewhere. And I think one of the really important things that comes out of the pandemic for us is a real realization that like a digital first approach with a digital transformation is important just as much to healthcare and health IT as it is to our own organization, right? Being able to service each other as co-employees, as our suppliers, as our customers digitally, as much as healthcare providers and healthcare professionals are going to look to service their patients in kind of what they expect is the new model of delivery. So I think it's kind of all tied into the same conversation where I think all boats are now shifted towards this more kind of patient-centric model where patients really are in the driver's seat. And it's not the doctor's waiting for you, it's the patient, the doctor's now waiting for the patient. And that whole shift in mentality, I think, is super important as like, I think the pandemic has shifted expectations, putting the patient really at the center of their care.
Right, yeah. We write and we research a lot about customer experience at eWEEK and user experience. Maybe we should add something called patient experience.
I mean, that's what we talk about, the PX, right? Like, are you building an experience, a really high quality patient experience that delights your patients on their way to health and happiness?
There you go. That's the goal, isn't it? Health and happiness, the ultimate goal. Aditya Bansod, the co-founder and CTO of Luma Health in San Francisco. Thank you very much for sharing your expertise and your perspective with us on eSpeaks.
Absolutely. It's been a pleasure, Chris.
Good. And for all of you following along to the end here, thank you very much. Have a great rest of your eWEEK. Thanks for joining us on eWEEK eSpeaks. Go to eWEEK.com to hear more conversations with IT thought leaders.